There is one organ which causes high blood pressure, and it's not what you think. And there are specific exercises you can use to target and fix your blood pressure easily. No diet, lifestyle changes, or medication required. Check the link in the description below, but for now, today's question.
The question, what are some high blood pressure symptoms? Answer by Angela Punis. The heart is a muscle that is designed to constantly pump blood around the body. It pumps blood that is low in oxygen towards the lungs, through the venous pipeline, veins, where it receives a fresh supply of oxygen. Video here. Blood pressure exercises VSLCB. Once the blood is fully oxygenated, the heart pumps the oxygen-rich blood around the body so that the oxygen can be used by the body's muscles and cells, through the arterial pipeline, arteries. Many GP surgeries now use digital, or semi-automatic, sphygmomanometers, which measures your pulse using electrical sensors in a cuff that is usually placed around your upper arm. Thiazide diuretics work by reducing the amount of water in your blood and widening the walls of your arteries. They are not recommended for pregnant women, or people who have gout, a type of arthritis where crystals develop inside the joints. Thiazide diuretics have been known to reduce the level of potassium in your blood, which can interfere with your heart and kidney functions. They can also raise on the level of sugar in your blood, which could lead to diabetes. Therefore, you will probably be recommended to have blood and urine tests every 6 months so that your potassium and blood sugar levels can be monitored. A few people have reported that they could not get or maintain an erection while taking thiazide diuretics. However, this particular side effect was resolved once the medication was withdrawn. The best way to tackle obesity is by reducing the amount of calories that you eat, and taking regular exercise. Your GP can provide you with further information and advice on how you can do this. A unit of alcohol is equal to about half a pint of normal strength lager, a small glass of wine or a pub measure, 25 milliliters, or spirits. Answer by Peter Foster. What are some high blood pressure symptoms? I had no warning signs of high blood pressure until it caused a potentially dangerous condition. Back in 2008, I suddenly developed seriously painful headaches above and around my left eye. I also noticed that my left eyelid was drooping and the pupil was not responding much to light. I had booked a doctor's appointment for the following Tuesday morning but was feeling so bad on the Saturday that I went to the NHS walk-in clinic. Because of the asymmetric way my eyes were responding, they sent me to hospital. My blood pressure was very high. I was given a CT scan that showed nothing. I was told I was suffering cluster headaches because of high blood pressure. I was sent home on Monday morning and told to see my doctor about medication. My doctor was not happy with this, saying that cluster headaches was just a description of symptoms and gave no information about the actual cause. He then sent me to another hospital to see Dr. Luke Bonetto, a consultant neurologist. Dr. Bonetto gave me a detailed examination and told me I had Horner's syndrome, due to damage to or pressure on a particular nerve bundle. He could tell from my symptoms which nerve bundle was affected, but I needed a detailed scan to find the exact location of the damage. Horner's syndrome is fairly rare, so I had several medical students brought in to see me while I was in hospital. He said that the CT scan did not have enough resolution to determine the location of the problem, so sent me for a head and chest MRI scan. This showed that I had a carotid dissection, caused by high blood pressure, that was distorting the nerve bundle that ran alongside the left carotid artery in my neck. This was causing all the symptoms. The carotid dissection had been found early enough that I did not need surgery, but I spent 5 days in hospital trying different combinations of blood pressure medications until they found a combination that would lower my blood pressure without making me feel dizzy if I stood up too quickly. 6 months later, I had another MRI that showed that lowering my blood pressure had allowed the carotid dissection to heal. A friend was not so lucky as me. The first he knew of his high blood pressure was when he had a stroke that left him partially disabled with weakness on one side of his body and slurred slow speech. Before that, he had thought he was very healthy. Answer by Thomas K. Reed. High blood pressure, medically referred to as hypertension, is considered the silent killer. High blood pressure, if not identified in the early stages, may cause severe damage to eyes, heart, and kidneys. Most commonly, causes of high blood pressure do not show symptoms at all. Hence, it is important to have blood pressure testing as part of the routine physical examination. However, people with uncomplicated high blood pressure may experience headache, blurred vision, shortness of breath, and dizziness. It is crucial that you visit your doctor and seek guidance on how to reduce blood pressure. Along with a few lifestyle changes, high blood pressure treatment (NT) will also be recommended. Please adhere to the suggestions of your doctor and work towards lowering your blood pressure. If ignored, hypertension can have adverse effects on your health. It elevates your risk of suffering from a heart attack, stroke, and can also cause kidney failure. If doctors claim that, if detected early, monitored, and treated, the consequences of high blood pressure can be easily avoided. So, please visit your doctor and get your blood pressure tested at regular intervals.